It may just be a one-letter change, but advocates out there hope it will help patients get a quicker diagnosis and better care. We're going to talk more about that now with Dr. Shahyar Kavusi. He is a reproductive endocrinologist with St. David's South Austin Medical Center. Doctor, welcome and thanks so much for being with us.
Thank you for having me. Appreciate it, Will.
We want to begin with just the basics here. What exactly is PMOS?
Yes, so the Polyendocrine Metabolic Ovarian Syndrome is classically known as, and for 91 years has been known as Polycystic Ovarian Syndrome, but it's a metabolic endocrine condition that a lot of women experience. As you mentioned, 10% of females have this condition worldwide, and that equates to about 170 million women actually worldwide. This condition involves increased elevated insulin levels, which also can downstream increase androgen levels and really throw off, for lack of better words, the hormone profile in that woman. She won't ovulate every month, has decreased fertility rate because of infrequent ovulation. But more globally, this name change really is very appropriate and is very, very, very overdue. I mean, it's been a long time they've been waiting for a different name because it's a metabolic disorder with health implications, generally speaking.
So just having that name change, you think, will have a pretty big effect for people?
I think so. I think most of us clinicians are really, really happy that this name change has happened. We've been waiting for this for a long time because when you talk to a patient, and we're talking about polycystic ovarian syndrome, it's very limited in its scope. The only thing you're thinking about is an ovary, which is very important in my field in reproductive endocrinology, but there's the big picture. There's a woman's health, diabetes, high blood pressure, hair growth on their body, a lot of different things that can happen, acne on their face because they increase the androgens, depression. There's a lot of components to this. There's metabolism, there's a reproductive aspect, there's psychologic and mental health, there's dermatologic aspects. There's a lot going on in the body of a woman with polycystic ovarian syndrome that has been suboptimized, and their metabolism is really slow because it's really hard for them to lose weight a lot of times.
I think a lot of attention has been specifically on this name change, especially recently with this news just coming out. But what does treatment look like for that?
Yes, so the first line always is going to be diet and exercise and lifestyle factors, lifestyle changes. If that's difficult in terms of getting a goal, in terms of weight loss, which can regulate a lot of those indices we talked about, like insulin and the downstream, bring the insulin levels down, bring androgen levels down, restore like the regular cycles, menstrual-wise and also health-wise, of course, be in better shape, have a lesser risk of cardiovascular disease, type 2 diabetes, all those kind of things that we can list. I mean, it can make a huge difference with medication that can supplement. There's metformin, also known as glucophage, that type of medication. There are different kind of meds, specifically anti-androgens that can decrease the hair growth. If they're not trying to get pregnant, they can use that. At that time, there's a lot of different things we can use to try to help these patients.
All right, now this is just the tip of the iceberg of what we could have with this conversation. So we appreciate you, Dr. Kavusi, with giving us this little bit of more information, and we look forward to other conversations in the future.
Thank you so much. We'll appreciate you.
All right.